Hello, Dr. Joy.
Hi, Ashley. Good to be here today.
Yes, thank you. Thanks so much for joining me. We had a major technical difficulty, but we've been around the world with computer, and we're ready to dive in here. I am ridiculously excited about this topic because learning about my mast cells has literally changed my life. And it's
Mhm.
so simple. And so the way this conversation got planned was you mentioned it in your talk at my conference back in the winter. And I was like, oh my gosh, I really want to talk to you about this. And you were like, let's do a podcast. And so here's where we are. Let's start though with a quick introduction. Well, it can be as quick as you want it to be, but tell my audience about yourself, your work, your family, what you're involved in. How about it?
So I go by Dr. Joy and I work as a pediatrician. I'm a board certified pediatrician and my focus is on integrative care for kids, and especially kids with development and behavioral differences. I see a lot of twice exceptional kids, a lot of kids with neurodiversity. And my focus is on the whole child, parent led, and neurodiverse affirming. So I do ongoing care and assessments for kids. And what I'm really excited about is starting to do more podcasts, having my social media presence as at the PDA doc, and just doing some more trainings, educational webinars, and just really getting the word out there about different ways of being and how that's okay and normal and it can be very healthy.
And thank goodness we have doctors like you. I always say that I'm a hippie and J. Crew because I grew up in a family that's very Western medicine oriented, and I believe in Western medicine. And I have a doctor or brother that's a physician. And then as I aged, I started to so my audience knows this, but I was injured as a kid. I have 4 compression fractures from a
Mm.
gasoline explosion. But then I had this PTSD thing that didn't seem to go away. And then they were like, well, that's called chronic PTSD. And so now here's some medicine for that, and here's some medicine for your back. And
Mm.
they kept throwing medicine at me. And then it's generalized anxiety disorder. And I was like, but what's causing this? Why? And so eventually I found myself in a rheumatology clinic. Um, and I tried 3 different medicines for, I always say rheumatology is
Mhm.
like predicting the weather. It's like, well, you might have ankylosing spondylitis, but it could be. And you're like,
Uh-huh.
try this sulfasalazine and see if that work. And you're like, well, I don't have malaria. Should I take a drug that's made for malaria? Um, and I found integrative medicine for myself first. Um, and man, I was like, wow, would this benefit Jack Barlow? And so
Mm.
since really early on in the days that I started with my functional medicine doctor, I have consulted with them with Jack on and off. And I mean, it has made a world of difference in our lives. And I know that is for you one of the components to it. This is a very long thank you. Um, but one of the components to that is you have to kind of be a rebel, right? So I'm
Mhm.
so happy that there are doctors like you that will take the time to understand our kids and will look for commonsensical strategies and partner with parents and all of that bucks up against insurance companies. And so all of that to say thank you.
Yeah, oh, of course. Well, and that's why I'm cash pay. And so because insurance
Yep.
companies, yeah, don't like it. Well, and the interesting thing about me is I came from a family that was, I think, where I grew up was kind of skeptical of Western medicine. And so when I ended up going in becoming a physician, I always had this mindset of always asking questions. Questions were good. And then in my training, I realized that the way physicians are taught about questions is that questions are not good. You're supposed to know the answer. And what it does is it really creates a lack of curiosity. So in my whole childhood is there was a lot of curiosity, a lot of questions, a lot of looking at things from different perspectives because I grew up between the US and Mexico and I grew up around linguists, so people that study languages and how language really affects how we think. So naturally, my
Mm.
I was perspective is like, okay, well, how are we can look at things different ways. And of course, keeping in mind, benefit support, things that will make life better for families and, stay away from things that, cause harm. But yeah, just like for me, it was very natural to look into integrative. And then I think what you kind of alluded to, how kind of sometimes family, life kind of pushes you in that direction as well. So so
I
that's
love
me.
that.
And it's very, very natural for me to end up where I am.
And it's yeah, and then it feels true to you, as a small business owner myself in practicing law, I have realized how important, they always say niche down. Every book that you read says find a niche, find a niche. And it isn't
Mhm,
until you love the niche that that
mhm,
makes sense, right? And so it goes with your personality, it goes with that natural curiosity and skepticism, and then voila, you're there. And I mean, that's why you're good at what you do because you like it and it does align with your own interests and values, which is really
mhm.
important. We're gonna spend the most of our time talking about mast cell disorders, mast cell. What do we call it, by the way? Mast cell disease?
Mast cell activation syndrome, mast cell disease. I think a lot of times people call it, yeah, mast cell activation.
Okay.
So,
Okay.
yeah,
So that's
I
what
think
we're going to
depends who you
talk
talk
about.
to.
When we were in your little introduction, you mentioned your Instagram profile, and it's got PDA in it, and PDA is something that I am seeing come up so incredibly often in my legal practice and in my advocacy practice. And I mean, when I say to a client, "Are you familiar with PDA?" and I describe it to them, like their eyes open and they say, "Yes, yes, that is like I didn't know there was a name for that. Thank you. What do we do about it?" So while we have the PDA doc on the line, um, give us your little brief description of what PDA is, so that my audience knows about your amazing resources.
So I always coming at this as a physician, as a doctor, I always feel like I have to kind of jump into the clinical world a bit, how it's not an official diagnosis, but it's a sense of understanding about how someone perceives the world, interacts with the world. And I like to describe it with families as it's a different wiring, a different way that someone takes in the world, and it's just more sensitivity in general. And so what is perceived by, let's say, someone else as like, oh, just a simple ask can be overwhelming demand that paralyzes someone who is a PDA. And so the sense is that it's part of autism currently, maybe it's going to expand beyond that. But it's when there are asks, demands, things that you want or things you don't want, it really prevents you from living life. And so how do you get around that to um, parent, to person, to whatever it may be, and be able to thrive?
Yeah, that's a great description because um you didn't even give the acronym, which, like, I appreciate. So the acronym is either a pathological demand avoidance, or it sounds like the autistic community prefers is it persistent demand for autonomy?
Persistent drive for autonomy, persistent desire for autonomy. So making it more positive in
Okay,
there.
then demand.
Yes, the
Demand.
demand.
I demand it. That's the
But
law
that's
you're
not, it's not a
speaking.
choice, right? So that's the thought too. It's not a choice. It's uh, it's a way of being. So it's not, a person isn't choosing to not do something, choosing to demand it. It's this is how they are. And I so that's why I kind of pull away from saying the acronym, but that's why I also like pairing this with talking with mast cell, because we talk about neurotypes, but what I am really wanting to talk about is body types. And I like to think of that when we talk about body types, because it's the sense that our bodies, different bodies, are not only just wired differently, but they interact with the world differently. And and so then it's just a real perspective of, you know, like I with the talk I said, talked about bendy, sleepy, sneezy kids. And so, kids that are just have looser connective tissue, looser joints, they're more sensitive to their environments and food, like all of these pieces. And so it's not, yeah, within that, it's not a choice. It's just, this is how the body is. This is how the body interacts, and that's okay. And let's
Yeah.
look at how we can support people to thrive.
And, I think that's like, I am a big proponent of infusing a lot of empathy into your advocacy. And so if I was at a meeting right now and we were reading a report from Dr. Joy, or Dr. Joy was in a meeting is, another person that knows about the child, what I would say is like, so 9 out of 9 on the Biden scale, or however many, whatever the
Mhm.
denominator is, I'm also the numerator. I don't think I can do
Yeah,
most of my tricks anymore because I worked really hard on strength, but I am
yeah.
bendy. I have very bendy, sneezy kids, and from a whole family. All of my cousins are like that. In fact, they even have like the super soft skin, and they're like delightfully uh, pale. And so we definitely have joint hypermobility. And I I talk a little bit about how I experience things that I experience and epiphanies that I had when I was like, oh, joint mobility um, leads to these things. But the other thing I think that you said that's so important that parents have a hard time describing is that it's very helpful to view the mind and the body separately. So when you're speaking on behalf of your child, at an IEP meeting or with your team or with a healthcare provider or whatever, um, you know, kids desire to assimilate. They desire to make friends. They desire to perform. They desire um, to do the demand, to perform.
Mhm.
Wash the dishes. Okay, I'll wash the dishes. Go potty. Okay, I'll go potty. They desire to do that. I always forget. There's a great Ross Green quote that's like, "Kids will perform if they could," or something. Uh, but their bodies get in the way of that. Their wiring, their neurological synapses, something gets in the way of that. And so it's our job, or at school, it's your job, people, to build the building blocks so that they can achieve whatever it is we're trying to achieve. Not so that they can do what you tell them to do. Although I did tell my
Mhm.
kid to do that today.
You got ever so often.
Well, and I mean, Joy, I think from a parent's perspective, these are two questions that I ask often when I talk to professionals about PDA. One is, there is an importance to complying. I am not a compliance based person, but don't go in the street can be a life or death command.
Mhm.
Um, don't touch the hot stove is can be life or death, or can be a very critical
Mhm.
command. So how do we balance that? Um, and then my other question is, um, are there building blocks to autonomy? Because sometimes the choice, like I notice my child does not have autism, he has Down syndrome. But he has some characteristics of our PDAers. And sometimes I give him a choice and I can tell that the choice itself overwhelms him. And
Mhm.
I
Yeah.
also think he doesn't have a ton of he doesn't have a whole lot of drive for
Mhm.
the autonomy. He's kind of like, do it for me. And I'm saying, well, would you like to wear your red shorts or your blue shorts? And he's like, I don't care, lady, just put some
Mhm.
shorts on me. I mean, 14, I should maybe put the shorts on him.
Well, that's what I
Sorry.
was talking. Oh, go ahead.
No, no, no. I mean, I would love to hear your thoughts on the two like kind of critical parent things that I hear a lot
Mhm.
in my practice that we all kind of navigate.
So safety, right? I mean, safety is important and it's non-negotiable. So, running out into the street is not safe. So sometimes it's avoiding environments. Sometimes it's interacting in different ways. I remember when my kids were younger and there was a parent who was like, oh yeah, my kid will always stop at the end of the block. And I was like, wow, you are lucky, versus me, I'm right there with my kid. Or I very much look at the environment. So I set the environment up for perceived autonomy. So instead of my kid running or being active, they're in this tricycle where they're pedaling. However, I have a handle on it. So it's perceived autonomy. They have their perception that they're pedaling by themselves. And yet I have this invisible way to help pause them and stop them because they need that. They need, and my kids are kind of the opposite. I'm just like, okay, just wait a year or two or three and you'll be happier. My kids were like a year after a year and they're like, no more strollers. And I'm like, really? Are you sure? It's right here. It would make her life easier. But yeah, so
Oh,
the perceived
I created this problem. We have what I like to call a teacher-led environment where
okay.
I am about as type A as they get. And so I created dependent little like uh snails that just suck onto me.
But it's also too like the interaction, right? Like and what kids need and what they desire in this. So yeah, it's just fascinating. And then so then it kind of goes to the next piece is like know your kid. What helps them, what hurts them, what makes life easier, what makes it harder for them. And for some kids, like lots of choices are not very helpful. Sometimes it's just starting. And then the next task, and then the kid can just move forward and take it. And then sometimes it just depends on the day, right? Like there are days where my kids can get dressed by themselves. There are days where I'm dressing them. And so I think it's looking at it all a continuum too, and not being like every day is going to be the exact same, or it's more like what does my kid need overall? And then what do they need in this moment? And what do I need as well too? Like, do I need to get out of the door and it's just easier for me to get them dressed, in versus like the long, overall long haul, right? I want to give them choices, but then also, not overwhelm them in it. And then just have fun with it. Like I said, if we throw in fun and laughter and singing, I mean, that just helps us feel more at ease. And that's actually what I have found. It was interesting when I found PDA, I was like, oh, this is how I parented. Like I always felt like the really odd parent that never fit in, that was just couldn't handle one kid, especially as a pediatrician. That's really humbling. I'm a pediatrician. I have, one kid in the store and I don't know where they are. Uh, but so yeah, I just think yeah, having that, what does your kid need overall? What do they need right now? And then what do you need? And and safety too. And what is safety? What you perceive safety needs are also can be different. What your neighbors perceive safety needs and what the other families perceive safety needs. I mean, just as an example, I mean, my kids are very physically capable, and one way of just having them get space was my kid would just call up to the rooftop, and I knew that they were safe up there. That's what they needed. Did I agree with it? No. I think it was the best choice? No, but it was much safer than me trying to pull them back down. But I would have neighbors
Uh-huh.
be like, your kid's on the roof. And I'm like, I know. It's like,
Yeah, it's fine.
like, what can I do about it? I'm going to give them time to just calm down. And it was just the wind in the face, the way to just have solitude, regulate. I knew it was regulating for them, and then it
Yeah,
would come down after a bit.
no worries.
So yeah, so what is the what are your big pieces? And for me, it was roads, right? Like roads were really big. I would be very willing to give perceived autonomy. And the other thing with one of my kids too, I even used when they were a toddler. I mean, again, no stroller, harnesses. where like I was the parent with the kid with the leash, and that was great because that they could run, but then I would prevent them from going into the streets. So
Yeah.
it's just a different way of parenting, and it's frankly embarrassing many times, but it's what what that's what your kid needs. It's what you need to have a sense of self and well being.
I think that's a really good point because as a parent, there are things like leashes, the harness where you're attached to them, where, when I had my oldest who's neurotypical, I would be like, oh my gosh, no, and like not for me. I'm not a judgmental, like an innately judgmental person. So it might be right for you, but not right for me. And then I had Jack, and I remember thinking, like, actually, I might change my position on this because if he could get out of the stroller, he could get the building blocks to walking in an amusement
Mhm.
park or the zoo or something. And in that case, my like kind of rigid position that I had established when I had my oldest held true. And Jack is not
Mhm.
super independent in places like that. And I think it comes back to confidence. I made him stay
Mhm.
in that stroller buckled in for so long because heaven forbid he go out and he was like an absolute hurricane of a kid. Um, and like have to chase him and put him back in there and all the things. Well, if I had had him attached to me, then he could have
Mhm.
walked with a little bit more safety. And there's things like that all the time. He uses an iPad to eat because he will not
Mhm.
eat independently without an iPad, and it's because it's
Mhm.
hard. It's hard to eat with low muscle tone.
Mhm.
It no longer
Mhm.
is, and we're kind of trying to wean it. But that's another example where, like, that's
Mhm.
not something I still don't let his older brother do that. I'm like, "Put down your phone and talk to me."
Mhm. Yeah.
Because he can, and that's a good place to have conversation, and the research supports it. But with Jack, independence is key. And so,
Mhm.
I think those are really good things to consider.
Mhm.
And that's hard to navigate. Can we take a little bit of a turn and talk about how this comes into this discussion about mast cell activation syndrome and histamine intolerance, and maybe you can tell us a little bit about what that is and then tie it together with this
Yeah.
PDA profile.
So mast cells are throughout our body, and they hold a lot of different um immune modulators, neuromodulators in them, and one being histamine. And so when they open themselves up and release everything that's in there, then that changes how our body interacts. And so if it's in our brain, sometimes it can affect our mood and behavior. If it's in our skin, we can get rashes. If it's in our gut, we can get stomach upset. And and so for some kids, they're more sensitive. They're more likely for these cells to be like, I'm just gonna release my guts out. And so maybe there's a certain smell that the kid smells, maybe it's a food that they eat, maybe it's a stress. And then they have these things that are happening to them. Maybe they're not feeling good, they're tired, they're upset. And so it's easy to for people to be like, well, just pull it together. Just fix it, and again, it's not a choice. This is, what's happening to them. So it's really looking at the root cause, looking at like why something is happening instead of labeling, oh, a kid is misbehaving or oh, kid has an upset stomach. We look at, well, why? Why is it? And so if we have a sense like if it's the mast cell, then we help settle them down, and sometimes it's less stress, right? Sometimes it's pulling the thing out that causes, the mast cells to get upset, whether it's a food. And then sometimes there's things to do to help settle them down as well. So it's so I like to talk about it in the work I do because it really can help an understanding of, okay, well, you're not someone that always has an upset stomach. This is because of mast cell. This is what we can do so you can enjoy life more. Or, let's make things easier. Maybe it helps with things, and anxiety. And the piece that is that a lot of these things that we feel, and in our body is so related to how our body takes in the world. And so that's why love to look at the whole child, and instead of just saying like, oh, I what I hate is like a kid's like, oh, this kid's oppositional, or this kid is like, I don't ever say
Me
that. I
too.
don't think that's okay to even say that. And I think too, then that goes too with kind of what we're both alluding to with our kids is kind of, you have these invisible disabilities that you can't see. It affects your way to be in the world. And so how do you support them as a parent, but then also in the school system with the doctors, because other people can't see it. They don't understand it. And it's easy to write it off as either bad parenting, kid is misbehaving, when there's a real reason for it and it's not a choice.
And we feel so bad for our kids when they're experiencing that. Like, you feel
Mhm.
so bad. I so wish I could help you. My kids got, like, lack of structure this week because of state testing. My husband's been
Mhm.
out of town for a week, and neither of my kids, even my senior in high school, does well with transition to summer. And we're like total summer
Mhm.
people, but like, what's it
Hard.
gonna look like? Who's gonna be my babysitter? All that stuff. And he's just had my kid with Down syndrome's had this crazy week, and we were talking about it this morning. Um, and, I said, honey, I think these three things are happening. And would it help to talk about the summer? So on the way to school, we talked about the
Mhm.
summer, but like, I just feel so bad for him because he's like swinging a yo-yo in the house. And I'm like, do you get
Mhm.
uncomfortable? I'm going to kill you. No, like, and, and I can't say those things out loud because that's not the problem. The problem isn't swinging the
No.
yo-yo, right? The problem is the dysregulation. Um, and it's hard. So what sorts of symptoms do you
Mhm.
see? And I imagine it's like a bunch of check marks that you're like, okay, there's three of these check marks, so I'm going to talk about mast cells. Like, at what point does your doctor brain say, I wonder if this is histamine intolerance? I wonder if this is mast cell
Mhm.
activation stuff.
A lot of times I think about kids that come in and maybe have allergies, seasonal allergies, sensitive skin, maybe they have some asthma. And, sometimes, there's just kind of sometimes there's more like autoimmune in the family is another thing I think about. A lot of the itises, the inflammations, all of those pieces. So, looking at what's in the family and then how the kid is as well. And then sometimes it's looking at if there's not pieces that fit. You're like, this just doesn't make sense. All of these different pieces aren't fitting together. So looking at, could this be mast cell, and treating it like that.
So, yeah, and I want to talk about treatment, but it might, just to give like a little bit of context, it might be helpful because the reason why I was so
Mm,
excited about this was last year around this time in the spring, I had 8 days of panic attacks, like several per
mhm,
day. And I get panic attacks, like I said, I've got like chronic PTSD. I had my first one the day after prom. And
mhm,
I tended to get them. I would notice a trend. I was in church and I was like,
mhm,
like, I didn't do anything at prom. Why is my conscience taking over? Because I like couldn't breathe and I got real hot and sweaty and tunnel vision.
mhm,
Thought I was going to pass out. And I have thought maybe this is blood sugar. Maybe this is my heart.
mhm.
Of course, I had 1,000 EKGs, just like anybody else with anxiety.
Uh,
And we know that by darn, my heart is as healthy as it could possibly be. And we just keep checking.
yeah, yeah.
And I and but then what I would notice is this trend where what I like to say is my body can't dump adrenal hormones, even good adrenal
Mhm,
hormones, the day after something great or even something stressful like a trial or a funeral. I would get this panicky thing. But panicky is different than like full blown panic attacks. So last year at this time, I had 8 panic attacks in 8 days. Well, I had like probably 20
mhm,
panic attacks in 8 days. And I thought, I'm in a cycle. I think I'm nervous about panic. And so I need to break the cycle. So long story short, of course, I went to my doctor and said, like, if I break the cycle with Xanax, that could work. But my doctor was
Mhm.
on maternity leave. They told me to go to urgent care. Urgent care says we don't do
Mhm.
Xanax because you have to have a relationship. So go to the hospital. And there was no way I was going to the hospital and telling them I had 8 days of panic attacks because I don't want a 72-hour-old. Like, and
Um,
me, I am wholly me. I am totally fine, but I can't breathe about 30 minutes a day. Um, and so I said no. And then so I went to my integrative doctor. Couple that with this history of this crazy um red rash thing that happens and itchiness. And the
mhm.
itchiness started when we were advocating for Jack to be in an inclusive kindergarten
Mm,
9, 10 years ago. And I got diagnosed at that time with Sjogren's, and they were like, "It's the
mhm.
butterfly rash that comes with Sjogren's." It also mirrors itself on my chest. Um, and they said, "Oh, it's Sjogren's, and you're gonna have, light sensitivity, sun sensitivity, all of these things." Well, so I go to my integrative doctor, and she says, "Well, I'm looking at last spring, and we talked about adding some
Mhm.
quercetin." And I was like, "Oh, I kind of remember that. Why did we talk about it?" And she said, "Well, you were itchy." And I was like, "Well, I must have had acupuncture and felt better." And she was like, "Let's try you on some quercetin." And she really told me about mast cell intolerance or mast cell disease. And I was like, "Oh my goodness." So I started taking mass amounts of quercetin mixed with like stinging nettle and some other things that I guess make it more better. And I mean, that day was the last day that I haven't had a
Mhm.
panic attack in a year. Um, it just was so, so good for me. So how do we treat it? For me, obviously I'm not a doctor.
Mhm.
And this is not medical advice, everybody, but like
Yes.
what sorts of things do we start to look at if we are experiencing the kinds of symptoms that you talked about
Mhm.
or like really like obvious histamine reactions.
Mhm. Well, if you go into an environment or, you do something that causes a reaction and it's pretty clear, you can remove it and then you don't have the reaction. I mean, that's ideal. Many times it's not as clear as that. So the ideally one of the pieces when I talk with families is trying to do a whole foods diet. And so, and again, this is, yeah, like you're saying, this isn't medical advice. This is educational because, it doesn't work for all kids. But
Yeah.
the hope is that, staying away from processed foods, staying away from all those different exposures could those foods could be the reason for having a reaction and for the mast cells, what's called degranulating, opening up and releasing what they have inside. And then the other thing too is we many times live in environments with lots of scents, lots of perfumes, whether it's in cleaning supplies, whether it's in personal products. And so removing that as well. So my hope is to start with removing things that might be causing the problem instead of having to add something more. And then seeing how that is first. And if that's enough, that's enough. And then slowly adding things back to see what could be what the issue is. And then, making sure there's, multivitamins, vitamin C can be really great for stabilizing or for helping settle down mast cells. And, and then from there, looking at other options for kids. A lot of times, looking at luteolin is the first step that I look at for kids. And then, yeah, and then jumping into antihistamines. So it's really preventing first. I mean, that's always the hope. And then from there, supporting the body, kind of bolstering it up with making sure it has enough vitamins and minerals. And then after that, looking at pulling down inflammation, pulling down reactivity, and then more targeted treatment. So that's always my hope and focus for kids and families. And then, of course, not making sure there isn't something else, right? That's there that could be going on.
Oh, I mean, that's so helpful. Those are all changes that we have made with our family in the last 10 years since I started with all of these
Mhm.
symptoms. And since I started going to an integrative doctor, like first thing we did was cleaning supplies. And then we just like
Mhm.
slowly, we already ate like pretty much only whole food, but then we like really started to do whole food. I have to do low histamine foods. I cannot,
That's
I
another
love
piece.
sauerkraut. I know, and but here's the thing is, I know that when I'm well, I can eat sauerkraut, I can eat guacamole,
Mhm.
I can eat leftovers. Um, so I know that I can when I am well. When I've got high stress or in the spring, when there's also
Mhm.
environmental histamines that are bugging me, then I do start to take antihistamines.
Mhm.
Like I'll take Zyrtec and I also take Pepsid AC, and then I also avoid those foods, you know. And
Yep.
I mean, but and then I think just like anything else, and this is advice um that I think, like, from a mom, um, advice that I can give is, like, when we tried to go dairy free with Jack, he was not eating
Mhm.
at all. Like, Jack was
Mhm.
really sick for a while. He had an autoimmune flare. We don't know what it is, but something, and he was, like, super skinny, and so we were supplementing with Carnation Instant breakfast. That's all he would drink.
Mhm.
And then we said, "Well, let's try dairy free. Maybe that's the whole problem." And we're giving him loads of dairy because that's all he'll eat is chocolate milk and chocolate
Mhm.
ice cream.
Yeah. And that's
So
why I
we're
say
like,
whole food doesn't work for all families.
duh. So then we went to like a plant-based thing. Well, there was no way that Jack was going to just switch to this plant-based journey.
Mhm.
So we started very slowly, and I just would dump out a little bit of the carnation and dump in a little bit of the milk, and we just kept
Mhm.
increasing his percentages of plant-based milk. Mhm.
Mhm.
And but it still had to be this high nutritious. I mean, the stuff smelled awful. Like, I don't blame him, but every time I would get down to about like 80-20, and he would say, "Ooh,
Mhm.
disgusting," and we'd have to start all over.
Oh my goodness.
And it was like,
It's just yeah,
it's
such a
little
challenge.
changes,
Little
right? Like,
changes,
little
yeah.
changes can make a big difference, and that's like, so many of us have done it successfully.
Mhm.
It's intimidating, but I think it really does work.
And I think too, it's not like an all or nothing. I think some there's some understanding that if you can't do whole foods every meal, just pick one meal. And that could be beneficial for kids. And so like anything, it's the thought of the load. So just like you were saying, those times when allergies, the pollen count is really high, life is stressful, you have to like stop with the sauerkraut and the leftovers. I mean, it's the same for kids too. Like what your
Right.
needs are overall, but then what are your needs today? And really, yeah, really keeping that in mind. Yeah, and whenever I also see that, kids having similar allergies and behavior struggles at the same time every year, I always think of that as well. Okay, like it's affecting how they're doing. And so maybe we have to switch up what we do in the spring or the fall or whatever it may be for the kid. So, or family, right? Um, and I guess with sharing stories, like, so for myself, I learned about hypermobility before this whole mast cell piece, and I've had panic attacks as well. And then I got to the point where I was taking so many allergy medications that I literally couldn't keep up with it, and my nose kept on dripping. And, like, I would see patients and I would lean over and my nose would wanna drip. It was embarrassing.
Yes.
I wasn't sick, but it was just literally I mean, mast cell,
Yeah.
like my reaction. So I started doing allergy shots, which was really helpful, but then it's harder to do in pregnancy, and that whole piece. And yeah, anyway, it's just such an interesting journey to be in and learn about. And then, and yeah, and then learning about like Histaquil. I love Histaquil, which has this like quercetin for myself. And, all of these just like help settle things down, which I mean, honestly, fine. I've done Zyrtec or Zetirzine many years, but yeah, some of these other ones, I think the difference is that they kind of just settle the mast cell so it doesn't get as tickly, so it's itchy and it doesn't release everything versus the other ones just kind of settle the histamine. Like, and there's all these other things that are
Yes. Yeah,
out
so you're
there.
fixing the
So
cause. The other
yeah,
thing you're fixing the cause. The other thing that works for me if I am super itchy is I will have an apple, and within like
mm,
an hour, an
int-
apple
uh,
helps. I
vitamin
read,
C. What is that?
I don't know. I read one time
Hmm.
that apples stabilize mast cells.
Hmm.
And because, I was like, okay, if I'm taking foods out, like what food should I be eating?
Yeah.
And apples and blueberries were the two things that it
Okay.
recommended. So for probably 18 months, I had blueberries every single day.
Mhm.
Not, prior to this, and I was like,
Yeah.
dude, I was feeling really well when I was doing that blueberry oatmeal breakfast. Now that I think about
Yeah.
it, and so I started doing blueberries again for breakfast. And then
Mhm.
an apple will really make a difference for me, like
Interesting.
noticeably, because I get so itchy, like it's certain body parts, my
Mhm.
ears, my nose, my head. And I mean, like
Yeah.
I'll scratch like actual abrasion onto
Mhm.
myself at night and stuff. So an apple, who knew? But you heard
Yeah,
it here
I did not
first.
know that. Yeah. Well, I know the talk that I did with you is I was like, okay, identify the different foods that could cause a problem, and just having schools think about this as well because of what they offer kids. And one kid might be okay all of the time, but another kid might have issues when there's more allergies going around for them, or let's say they have something stressful going on in their life, or maybe testing week, right? Like, just like you're
Mhm.
saying, those kids that
Yeah.
like state testing could be a harder time. So yeah, it's
Yay. Dr.
lots
Joy,
lots
tell
to.
everybody where they can find you to learn more about these super important topics.
So you can find me on Instagram at the.pda.doc. You can find me online at orchidpediatrics.com. Such a long name. ORCHID pediatrics, PEDIATRICS.com. And then in Canada, it's .ca. So I also have a Canadian website. And I will be sending you a handout on mast cell so people can get that and use that. And if they want to learn more, I'll have a mast cell course. And all of this is just wanting to have fun with the learning, and for a couple of reasons, right? It's more interesting to learn, but if we're less stressed, it's our life is better, and it actually helps settle our mast cells. So reasons behind pulling in the fun, the joy in it all.
I love it. Thank you so much.
So, well, thank you for having me, and excited to learn more from you and your story.
Yay.